On a medical campus designed to heal, sometimes visitors will still feel ill
That is very frustrating.
long after the initial visit.
Jeff, just give me your name.
Jeff Deserich,
Jeff Deserich felt sick the moment he read his bill.
How long were you there?
20 minutes?
Not long.
No.
Medical notes called it impacted cerumen. You can call it a buildup of earwax. Weeks after he went to UC Health's ear, nose, and throat clinic to remove it, he learned the common procedure would set him back $500.
And so, I was like, okay, 500, dang, it is worst case scenario.
Worst case. Until a few months later, that case got even worse.
If you had any idea how much this was going to cost, you wouldn't have gone.
I would not have known. Yeah, no, not at this point.
The $500 bill was just for the nurse practitioner who removed the earwax. UC Health wanted another $1,300 for the procedure itself.
I'd had a 20-minute procedure to remove the earwax from my ear and had been charged almost $2,000 total for it.
Think of it this way. Jeff could have flown to Paris, stayed a couple of nights, had a few good meals, and then flown back to Colorado. All for the amount UC Health wanted to clear his ear.
Something doesn't feel right with that price.
We asked a trio of medical billing experts their thoughts on Jeff's bill.
It's a ridiculous price.
It is totally obscene.
It's outrageous to pay over $1,800 for removing earwax from an ear.
Each told us what Jeff long believed. UC Health's $1,800 bill to remove earwax was more gross than, the earwax.
And in the end, it's really hitting patients.
As CEO of Goodbill, a patient advocacy website, Patrick Haig makes a living looking at medical bills. He knows government-run Medicare would have paid little more than $57 for the procedure. He also says an $1,800 bill for the earwax removal for a privately insured patient isn't necessarily the headline you might think it is.
So that's actually kind of what's more terrifying, is that these are pretty ordinary run-of-the-mill daily average American hospital bill cases. Like, this is a really normal thing.
Normal because patients like Deserich are subject to often nonsensical negotiations between medical providers and insurance companies. In this case, Aetna. Look how UC Health billed Aetna. These are the codes for the procedures. Next to 69210, which is the earwax removal code, UC Health put in 0361. That's the code for minor surgery.
And all the data shows, indeed, that was pretty unreasonable.
Haig knows what happened to Deserich wasn't minor surgery at all. Problem is, UC Health says it doesn't matter. According to a spokesperson, Aetna pays the same case rate regardless whether it's a procedure or surgery. This is their contract, he added.
I wish I could say I was surprised at this point. I'm always infuriated.
Adam Fox works with the Colorado Consumer Health Initiative. He says the first thing patients should do when receiving a big bill, look at their explanation of benefits, or EOB, from the insurance company. The EOB will tell them how insurance is handling the claim.
How much of the services they are covering, what the contracted rate was, and what the patient responsibility to pay is.
In Deserich's case, his insurance paid nothing because he had yet to hit his deductible, the amount patients have to pay before insurance kicks in.
Nearly everyone has a story about being overcharged by our healthcare system.
Cynthia Fisher heads PatientRightsAdvocate.org. She yearns for the day when patients can search costs for medical procedures in the same way we do now for flights online. Need a tonsillectomy? Have Blue Cross? Boom, here's your price.
Every bill is a surprise if the patient doesn't know the price up front.
We're close to that point now. New federal laws require some transparency, but it's not perfect. Here's what happens when you go to UC Health's website right now and look at the potential price for earwax removal. Boom, nothing.
I actually teach a financial literacy class, and so this is a lesson I'm teaching them now, so hopefully I'm able to pass this on to them.
Part of that lesson, says the high school teacher, UC Health has a long history of suing patients who don't pay. It's why he says he's now on a payment plan.
I'm paying $100 a month. It's going to take me the next year or so to pay it.
That doesn't feel good.
Agreed.